Hi, this is QD Video, brought to you by RheumNow.Live. You know, at RheumNow.Live, we're going to have a tremendous amount of interaction time. This is a 2-day meeting. There's going to be somewhere between 3.5 and 4 hours of Q&A with the faculty, and that's not even counting the Q&A that's going to go on at the end of their talks. It's going to be very different. You'll see. Read up on it. Today's case is entitled The No-Show. This is a nice gal who I've known for maybe 15 years. She came to me in her 20s, and she has Behcets. She's an African-American female who's had Behcets diagnosed based on recurrent, painful oral ulcerations, genital ulcerations, rarely rectal ulcerations. She's had occasional abdominal pain and conjunctivitis, had polyarthralgias, occasionally a swollen joint, occasionally low-grade fever. She responds well to high-dose steroids, big surprise, and really nothing else. She's been tried in the past on hydroxychloroquine, colchicine, acyclovir, azathioprine, methotrexate, Enbrel, Humira, vitamin A, and tetracycline. Again, when nothing works, you'll try almost anything for people having recurrent severe ulcerations. So that isn't really the problem in this gal. She does really well. I've taught her not to self-medicate herself with prednisone. When she gets into trouble, she does call us and we manage her. The problem has been for her coming to clinic. She lives about an hour and a half away. She's missed and been a no-show for 4 out of her last 5 visits. And today was the usual visit. We discussed how to manage the one active big ulcer she's got going in the vaginal area. But the big issue was, can I see her again? Do you fire patients from the clinic because they don't come in? I explained to her it's a problem because she's taking away valuable time from other patients who are waiting to get into the clinic. And in addition, she's turning her absences into my financial loss and really hurts our business model. I have a Twitter poll out right now. You might look at that on Twitter under RheumNow and see how it goes. I ask people, why would you fire a patient? Would you fire a patient or discontinue their care just for being non-compliant with visits, or do you need other reasons? There are a lot of reasons. I've asked my partners, and both of us are sort of the same ilk. We don't fire people because we don't like them or because they're difficult. We don't fire people when we don't know what to do with them, because it's our job to know what to do with them. We don't fire them for bad behavior even. I can count on one hand the number of patients I fired in my whole career. But it's not unreasonable to fire someone for chronic noncompliance to make the point that you're hurting yourself and you're hurting my clinic. Go somewhere else. It's not unreasonable to fire someone for not paying their bills or expecting to get free care without negotiating that with you. That's kind of insulting as well. There are other reasons, but I don't think it should be personality, and again, this is my own personal preference. Again, the Hippocratic Oath thing where you sign on for good or for bad, how to manage people, and just because someone's tough, personality-wise, schedule-wise, intelligence-wise, doesn't mean that you can bail out on them. And again, it's your job to be the strong coach and get them through the rocky waters and make them well. So again, difficult Behcets, but the difficult discussion is how to get them to come back. And my statement today was no more second chances. You've had 34 second chances. In the next 2 years, the next visit she misses, she'll get a letter saying, I'm so sorry, but you're gonna have to find another doctor. And it would kill me to write it, but you have to write it. And she gets it. She's sorry about it. She's got all kinds of reasons why. I don't necessarily need to know reasons why. But it's something, again, we're not just working on the relationship, we're working on how she is as a patient. And you know, patients don't get a handbook on how to become a patient. Most of the patients come to you, they don't know how to be a patient, which is why the difficulty is often in the first 4 or 5 visits, when they may or may not follow your instructions, when they may not fill the prescription when, you know, the idea is that they might be hurting themselves for fear of what they don't know. But again, it's hard to be a patient. It's hard to learn to be a patient. It's my job to sort of coach them along and make them better. She knows how to be a good patient at this point. She needs a reminder. That's it for this week. Check out RheumNow.Live.